Greetings, viewers all over the world. We bring the heart of God to nations at large. This is God Voice TV. On the 26th of June 2024, in Volume 3 Messages to the Nations, the man of God was moved by the Spirit of God. He said he saw a global wave sickness coming, and it will be said to have been caused by an animal, a monkey. Viewers, in the Volume 2 Messages to the Nations, the prophet said that Africa will suffer for a common sickness this year. Next year, it will be a major target. Let us hear what the prophet said and its fulfillment.
Also, I saw a global wave that is coming. Some will say it is caused by animals, e.g. like monkeys. So those of us that were in that class, you will know the day we were given this at 26th of June, you wrote it down. Those of you that was there live. So they will say it is monkeys. I saw it planned by the enemy.
Few African nations will suffer for common sickness this year. Next year, it will be the main target. Let us be on our feet in prayer. Viewers, we leave you for now. Orders will be given as God has permitted.
The World Health Organization has declared a global public health emergency following an outbreak of a new strain of the Mpox virus in Africa. The virus, formerly known as monkeypox, can be passed on through close contact and causes flu-like symptoms and lesions on the body and can be deadly. It's now been detected in at least 13 African countries, but one country has been hit particularly hard, the Democratic Republic of Congo.
Mpox is surging across Africa. And this is ground zero. Thousands of cases have been reported in the Democratic Republic of Congo as a new outbreak grips the country. It's already claimed at least 450 lives, most of them children, and it's showing no sign of slowing down.
The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Formerly known as monkeypox, Mpox spreads through close contact, including sex, causing flu-like symptoms and painful pus-filled lesions. But this new strain is proving more infectious and even more deadly. And experts fear the growing outbreak in Africa could just be the tip of the iceberg.
We believe that it's already a risk for international spread, and of course, there is also the chance that it could spread beyond Africa to other regions of the world.
The World Health Organization last declared Mpox an international health emergency in 2022, with cases in more than 70 countries. That was largely shut down with the help of vaccines and treatments in rich countries. But very few of those are available in Africa, and global health officials hope this new emergency declaration will kickstart an international effort to contain the disease.
Julian Tang is a virologist at the University of Leicester in the UK. I asked him to tell us more about the surge in Mpox cases and how this outbreak differs from the one 2 years ago.
The difference is really due to the different clades or strains, if you like, of this Mpox virus. The strain from 2 years ago was a global strain, and the clade 2, which is the so-called West African strain, and it proved to be much milder and more limited in terms of clinical severity than the original clade 1 virus. The one that's now spreading across Africa is a branch of the clade 1 virus, now termed clade 1b. And this is part of the original strain from the DRC, Democratic Republic of Congo. And this has a higher mortality, is more severe clinically, and may be increasing transmissibility compared to the original endemic clade 1a strain from DRC.
Talk to us more about this transmissibility, because this Mpox variant has now, this new strain has spread to 13 countries, the outbreak. Hundreds of people have died, mainly children. Why has this new variant been able to spread so quickly?
Yeah, so that's a good question. I think we're still looking into this, but the original strain from DRC, the clade 1a, if you like, was limited in terms of that it would only spread beyond maybe 3 or 4 generations, and then it would die out. And it's often transmitted from animal reservoirs in the original endemic area. Now it looks like the virus has adapted better to human transmission. Again, something we saw with COVID-19 after several years. But this virus has been around in Africa for many more years. We've known about it for over 50 or 60 years. So I suspect that more human cases, are allowing the virus to evolve and transmit more efficiently between humans. Again, like we saw with COVID-19 and the SARS-CoV-2 virus.
Welcome to the programme. I'm Zaheer Raman. The World Health Organization has issued its highest state of alert after a surge in Mpox virus infections in the Democratic Republic of Congo. Cases have now emerged far beyond the country's borders, showing how contagious the disease is and the international risks that it poses. Within the DRC, more than 7 million people have been displaced by decades of conflict, many forced to live in crowded conditions where the disease can run rampant. But in a nation of 100 million people and fighting in the east, vaccination is a huge challenge. And there's a shortage of vaccines, with only a small number approved for use globally. So can the DRC get the help it needs? Is the world prepared for this outbreak? And can the spread be stopped? We'll be putting that to our guests shortly. But first, Kulsum Sharif has this report.
A city at the heart of an armed conflict in Eastern Democratic Republic of Congo for decades is now on the front lines of another battle. Goma is ground zero in the latest outbreak of Mpox. The rapidly spreading infectious disease is sending patients to this makeshift hospital in North Kivu province.
At first, I felt a headache, fever, muscle pain and pain in my groin. After spots started to appear on me, I thought it must be an infection. My body has completely changed.
The nation has reported around 16,000 cases this year and most of the deaths. It led the World Health Organization to trigger its highest international alert as a global health emergency on Wednesday. The virus spreads through close physical contact with someone who's infectious, contaminated materials or infected animals.
I am worried. We have been shown images on the phone and on TV of people who are suffering from the same illness. I'm scared and I am so worried.
Mpox, formerly known as monkeypox, was first detected in research monkeys in Denmark in the 1950s and in humans in Congo in 1970. But the recent strain appears to spread more easily. The WHO says infants and children are more at risk.
75% of cases are in children under 10. Only 25% are in adults between 15 and 50 years old. It should also be noted that around 70% of these cases that come here are cases from camps for internally displaced people, so there is a high vulnerability within the camps.
The African Centers for Disease and Control and Prevention says Mpox has been detected in 13 countries this year with more than 500 deaths. Other countries are now seeing cases, including Sweden, reporting its first case this week. Health authorities in Pakistan have also detected one case in a passenger returning from the UAE. In 2022, the Mpox outbreak was reported in more than 70 countries. But its spread was slowed within months with vaccination programs and drugs in rich countries. Experts say there's an urgent need for vaccine supplies in African nations to stop the spread of the virus.
I would not recommend a general vaccination campaign for the general population or at-risk populations at this stage. It is also clear that the vaccines that are available globally are urgently needed in Africa, are urgently needed in regions where the virus currently is spreading, and there is a severe shortage of vaccines.
The goal of treating Mpox is to take care of the rash, manage pain and prevent complications. Getting an Mpox vaccine will prevent infection and help curb the outbreak. Global pharmaceuticals are promising millions of doses in the coming months. Kulsum Sharif, Al Jazeera for Inside Story.
So let's bring in our guest for this edition of Inside Story. In Geneva, Margaret Harris, spokesperson for the World Health Organization. In Goma, David Monkley, director of the aid agency World Vision's operations in Eastern DRC. And also in Geneva, Mukesh Kapila, Professor Emeritus of Global Health and Humanitarian Affairs at the University of Manchester. He too was formerly Director for Emergencies at the WHO. A warm welcome to all our guests. Dr. Harris, can I just begin with you in Geneva? How worried should we be about this outbreak? It's focused in Africa, but as we see now, it is spreading beyond the continent.
Certainly, we don't call a public health emergency of international concern unless there is a reason for worry. I mean, the hint is in the name, international concern. And what we're worried about is the detection and rapid spread of this new strain, Clade 1b in Eastern DRC. It's the fact that it's spread so rapidly. It's also been detected in neighbouring countries that had not previously reported any types of Mpox. And there clearly is potential for further spread within Africa, but also beyond into the rest of the world. And there is a need to try to stop it.
Indeed, we'll speak more about the actual biology of Clade 1 and Clade 2 a little bit later in the programme. David Monkley, just to get your general impressions, you're, as we say, at the coalface dealing with your staff and with your colleagues, not just in your agency, I'm sure you're coordinating with many other agencies as well, about the problem of Mpox right now. Just give us an overview of where the focal point is for your aid operation.
Yeah, this is a crisis on top of a crisis, simply due to the fact that in Eastern DRC, there is a conflict that's been long-standing that has taken 2.5 million displaced people into camps in and around Goma in horrid conditions. So much of the work that we were doing was on really just basic food provision, some general cash support, protection services, really the basics. For this to come into these camps at this point is really horrific. It's a new crisis. And these camps, again, you have high numbers of malnourishment from children. You have high cases of abuse. These are really perfect conditions for the Mpox epidemic to grow quickly. So it's a chief concern for us to do what we can now to really limit this as much as possible.
Dr. Mukesh Kapila in Geneva, you're no stranger to these sorts of emergencies and certainly this type of problem that the DRC is facing right now. In terms of the here and now and the long-term prognosis, let's just talk about the here and now and what you would expect to hear from the authorities in the DRC in how they are trying to help their health services and their health personnel on the ground with what's going on right now with Mpox.
I think national health authorities in DRC and surrounding countries need to upgrade their own preparations. That means making sure that healthcare practitioners are familiarized with the symptoms and signs, ensure that they have systems in place for surveillance and testing, and to put into place preventive and public health measures, which include, for example, hygiene, sanitation, water, and infection control, which I think has an advantage. Not only would it help against Mpox, but also against many other endemic communicable diseases, including recent epidemics, which are still grumbling away in these parts of the world. So that's the number one step to be taken, and to prepare the public as well to be recognize the disease when it happens in their families and communities and bring it to the attention of the healthcare providers so that the outbreak as it evolves can be properly tracked.
Yeah, we'll talk about how they actually get that word out as well a little bit later in the programme. Margaret Harris in Geneva. I mean, how problematic is it to be able to deal with this when there's also conflict in the area? Obviously, you're dealing directly with your medical colleagues and equivalents in the DRC, in government. But at the end of the day, the trauma is hundreds of miles away from the capital of Kinshasa.
Indeed. Conflict makes everything more difficult when you're dealing with public health. That the advice indeed is to say, come to the health centre, get treatment, protect yourself. Now, if you're a displaced person, you're in the middle of a conflict, you can't get to the health centre, you can't protect yourself. And as David mentioned, you don't have food, you don't have water, you don't have the safe conditions. So at the same time as we take all the actions, which we are taking, to prevent the spread, there needs to be much more effort to resolve the conflict and support the population. Otherwise, you will just continue to have problem on problem, as David said, crisis on a crisis.
David, can I come back to you in Goma? Can you just tell us a little bit about those living conditions and the situations that have been displaced, not just once, but maybe twice or thrice, are actually facing? Because this all adds to the trauma of not being able to have clean health facilities, clean water, clean food, and accessibility to medical care.
Yeah, these camps, they really sprung up overnight. They were unplanned. So people would literally find themselves on the side of a road at different points in or on the periphery of Goma, and poof, all of a sudden it would be 10,000, 15,000. The other day was at a camp for 22,000 households, over 100,000 people. There was garbage everywhere. There's no strong sanitation system. We in World Vision, we provide, again, emergency food and cash and some hygiene support, but we're overstretched. This is so big. There's hundreds of thousands of displaced people just around Goma. So for this to make itself known, for MPOX to enter into these camps, we're overstretched as it is. We're underfunded as it is. So to be able to find the resources necessary is incredibly difficult, which is why we're asking the international community to step in immediately, because we need more support in these camps.
David, I'm just going to halt our little conversation here for a moment to give our viewers a little bit of context, and then I'll be coming to Mukesh shortly, because the Democratic Republic of Congo has been at the centre of the recent outbreak. As we've just mentioned, it accounts for more than 90% of the reported infections. Burundi, Kenya, Rwanda and Uganda have reported their first Mpox infections in the past month. Now, those cases have also been identified in Nigeria, Cameroon, Central African Republic, South Africa, Ivory Coast, Liberia and Ghana. It's also sparked concerns about spreading to other countries around the world. And as we just mentioned, Sweden has recorded its first case, and Pakistan too has increased screening of passengers at its airports after a traveller tested positive for Mpox. So we've given our viewers at home, Dr. Mukesh, an idea of how far and wide this is going. Porous borders across the conflict zone of Uganda, DRC, Burundi doesn't really help matters. And now we're seeing Sweden and Pakistan in that whole mix.
A new case of Mpox, formerly known as monkeypox, has been recorded in the country, according to the Department of Health. The DOH says it received information on a newly recorded Mpox case on August 18. This is the first case of Mpox in the country this year, raising the overall logged cases nationwide to 10. The country's last recorded Mpox case was in December 2023. All previous Mpox patients have recovered. According to DOH, the Mpox patient is a 33-year-old male Filipino national who resides in the National Capital Region. The patient has no travel history outside the Philippines, but the DOH says it had close, intimate contact 3 weeks before onset of symptom. The agency adds that the patient's symptoms started more than a week ago with fever, which was followed by findings of a distinct rash on the face, back, nape, trunk, groin, as well as palms and soles 4 days later. The common symptoms of Mpox include skin rash or mucosal lesions, which can last 2 to 4 weeks, as well as fever, headache, muscle aches, back pain, low energy, and swollen lymph nodes. DOH Secretary
Viewers, you can see how far the eyes of Jesus Christ can reach. Yes, even in our situations, this is to remind us that Jesus Christ sees it and He is concerned about it, to grant us solutions to our problems. Do not forget, This channel is all about Jesus Christ. Keep watching God Voice TV for the salvation of souls.